Hello, this is Stasha-Gae Roberts, nurse practitioner and owner of Compassion Primary Care. Thank you for taking the time to watch this video. Compassion Primary Care is an integrative practice treating individuals 18 and older in Brandon, Florida. At Compassion Primary Care, we treat you like a person, not a number. Patients are seen virtually or in the comfort of their own homes. Today, I will be discussing magnesium. Magnesium is one of the most abundant and essential nutrients in the body. Most magnesium is found in our bones, soft tissue, and muscles. Over 300 enzymatic reactions rely on magnesium as a cofactor, including glucose and blood pressure regulation, energy production, formulation of DNA and RNA, and support detoxification. It also plays an active role in transporting calcium and potassium ions across the cell membrane and is therefore essential for nerve impulse conduction, muscle contraction, and normal heart rhythm. Magnesium deficiency is common despite its availability in several dietary resources. Common food sources of magnesium include green leafy vegetables, legumes, seeds, nuts, and whole grains. Medications that can increase the risk of magnesium deficiency include proton pump inhibitors, loop and thiazide diuretics, nephrotoxic drugs, meaning drugs that can be toxic to our kidneys. These include aminoglycoside antibiotics, cisplatin, digoxin, corticosteroids, oral contraceptives, and macrolide antibiotics. A common one is azithromycin or Zithromax. Certain conditions can increase the risk of magnesium deficiency by the following mechanism. There is either an increase in the amount of magnesium that's excreted through our urine. There is a reduced absorption of magnesium in the small intestine, or there's an intracellular shift of magnesium. Individuals with inflammatory bowel diseases, celiac disease, chronic diarrhea, chronic alcoholism, metabolic syndrome, diabetes, hypertension, and obesity all have increased risk of magnesium deficiency. Symptoms of magnesium deficiency include loss of appetite, nausea or vomiting, fatigue, muscle weakness, numbness, muscle cramps or spasms, anxiety, heart palpitations, and even mood disorders. These symptoms are broad, and it is possible to be magnesium deficient and not even know it. The best way to evaluate your magnesium levels is to have a blood test. I prefer to order a red blood cell magnesium on my patients because this provides a better picture of their magnesium level in comparison to serum labs. Hair, urine, and micronutrient analysis are other ways that evaluate magnesium levels. Now, there are several forms of magnesium, and each has its own unique benefits. I will briefly review some common ones here today. Magnesium citrate. It's well absorbed, but it's mostly used for individuals that have constipation. Magnesium glycinate. It's gentle on the stomach and does not cause some of the gastrointestinal effects like other forms of magnesium, and it has a relaxing effect. And so it's commonly used for things such as stress reduction, anxiety, and even insomnia. Magnesium oxide. This is a poorly absorbed form of magnesium, and it causes a lot of gastrointestinal issues such as diarrhea, heartburn, and indigestion. It is often used for constipation, but quite frankly, there are other types of magnesium that can be used for constipation and are gentler on your stomach. Magnesium chloride. It is also easily absorbed, and it can help to alleviate pain and digestive issues such as heartburn and constipation. Magnesium malate. It's easily absorbed, it's gentle on the digestive tract, and it's also commonly used for chronic pain. Magnesium orotate. It's easily absorbed. It can be used for indigestion or heartburn, and it has demonstrated some cardiovascular benefits. However, this form of magnesium can be slightly expensive. Magnesium taurate, it's also easily absorbed, and some benefits include treatment for people with high blood pressure or hypertension, preeclampsia, and even diabetics. Magnesium sulfate, it's commonly found in Epsom salt, and so it is absorbed topically through our skin, and it can provide a relaxing or calming benefit. And lastly, magnesium threonate. It's unique in that it actually crosses our blood-brain barrier, and so there's promising research that shows that it's actually beneficial for those with memory or cognitive issues. Magnesium supplementation is generally safe and tolerated by most people. Individuals with kidney disease, heart block, bleeding disorders, and myasthenia gravis should speak to their clinicians before using magnesium. Common symptoms of magnesium excess can include diarrhea, nausea, and abdominal cramping. More serious complications can include irregular heartbeat, low blood pressure, and even difficulty breathing. Magnesium is essential to our health, and most people are magnesium deficient. I've already talked about some common issues causing magnesium deficiency. Our soil is poor and often delinquent of magnesium, and then the different insecticides that we use on our foods can also cause some magnesium deficiency. Speak to your PCP about how magnesium can benefit you. If you want a clinician that utilizes an integrative approach to manage your overall health, please call or text us at 813-669-3084. Again, thank you for watching. Please like, share, and subscribe. This is Stasha-Gae Roberts, nurse practitioner and owner of Compassion Primary Care. Thank you for taking the time to watch this video. Bye-bye.